Good morning.
Good morning.
This is Dr. Noor, one of the children's doctor. Am I with Mrs. Aziza, the mother of Mohsin?
Yes, doctor. This is Mrs. Aziza.
How are you, Mrs. Aziza?
I'm very fine. Thank you for asking.
Today I am here to talk to you about your son Mohsin. Is it okay for you? Is this a right time?
Yes, doctor. That's the very reason I'm come over here. I'm very worried about Mohsin.
I can understand your worry, and I also know about some of the things I got to know about Mohsin before coming to you. But before that, anyone wants to attend this session with you?
No, doctor. It's fine. I'm alone. There's nobody with me.
Okay, Mrs. Aziza, tell me what are your concerns about Mohsin?
Yes, doctor. See, it's been already been 5 months, and my child has been suffering for this 5 months. I can't see him in pain, doctor. He's having this severe pain all during the day. Although when he rests in the weekend, it's fine, but it's really been a very bad time. And we've been to the general practitioner. I have been telling him so many times, please get a scan done. Please get a scan done, but see what he's done. He's just referred me to you and he's not even done the scan.
I am so sorry, Mrs. Aziza. I can understand your feeling that your son has 5 months pain and you really wants to know what is happening. That's why he messaged her. That's why he referred you to us. Actually, Mrs. Aziza, when we see about your son, he has his school performance is very good. This is a very good point for us. And he has a headache. I do agree with you, but it improves with sleep. This is very good point. And as such, he has no vomiting and no other complaints, as I know. Right, Mrs. Aziza?
But doctor, when he is in that pain episode, it's really bad. I can't see scan done. What's the big deal?
I agree with you. Right now, presently, we don't see that he has any problem inside his brain, because you see, he is doing very fine in the school and he improves with the sleep and his vision is okay. He has no problems, no vomiting, he's fine. So we just want to look into him. What is the main cause of his headache? So for which we can have some referrals for him, like we can refer him to a psychologist or even a headache clinic.
Psychologist, doctor, is my child having some psychiatric illness, doctor?
No. What the psychologist will do is he will sit with your child and will find out what exactly is his routine and what is making him, like you see, he is better in the weekends and weekdays he has problems. Maybe
Yeah.
something stress he has because he's going to the school and he has to complete the school work and lots of things. Maybe this is the reason, or maybe his sleep in the night during weekdays is not sufficient. Maybe this is the reason. So to evaluate what is the reason.
So what do you feel, doctor? What is the reason that why my child is having this headache?
Yeah, this is what I want to convince you. We have to sit with the child and also check his routine to know what is happening, what is stressing. The main cause for this headache, what we call it as tension headache, is from the stress. Maybe he is getting stressed with it, and this is the reason.
But doctor, when I was searching on Google, I found out that even a person with brain tumor or some hemorrhage, something like that, causes headache. So that's why I was just telling you, go in for a scan, go in for a scan.
I agree with you, and I can understand your concerns, Mrs. Aziza. Actually, it's to tell that there is some brain tumor or something, we don't see the symptoms, what we call it as the his presentation. Symptoms means his presentation, which is suggesting us like no early morning headaches or vomiting, or he doesn't has anything like seizures or any abnormal things which will give us a clue that he may have the tumor. It's a simple headache which is being caused by the stress, for which we should evaluate his routine activities during the weekdays, so that we can overcome it and solve his problem. Am I clear with you, Mrs. Aziza?
Yes, doctor, thank you for explaining it to me. But won't you even suggest any medicine right now?
Yes, right now my suggestion for him is whenever he have this headache, see to it that you give him a good rest. He should sleep well, avoid his if he's watching any screen, like avoid his screen time, reduce his playing time only during the attacks so that he can rest more, and check what is the problem, so that you can also maintain a diary for him during the weekdays, like why he is getting this attack. If it is the same reason, you will get to know, you can remove this reason. All these things can be done, but last but not the least, what I want to tell you is the medications. You use only when all these things don't work with you, only sometimes, because medication using too much is not good, which I suggest you, like painkillers like paracetamol or ibuprofen, like this. Am I clear, Mrs. Aziza?
Okay, yes, yes, yes.
Finished or?
Yes. What's the time? I think it's
Okay, go ahead. So
okay.
any other
Sorry,
concern?
sorry. Yeah, just now finished. Sorry, 6 minutes finished.
Okay,
Okay,
any
so
other
Sorry,
concerns you
sorry,
have?
7 minutes. Yes, yes. Sorry, sorry.
no other concerns. There's just 2 minutes left to summarize.
Yeah, so regarding, as I told you, the diagnosis of your child's condition is the tension headache, which is usually caused by the stress, and the management also we discussed. Regarding if you're worried, we will also refer you to the headache clinic and the psychologist along with it to see what is happening. And also we can give him some behavioral therapies for the lifestyle modifications. Is it okay,
Okay,
Mrs.
doctor.
Aziza?
Yes,
So
yes.
I will summarize to you what we discussed today in this session.
Yes, doctor, go ahead.
Today we were discussing about the Mohsin's headache, which is lasting for 5 months. He has this mainly during the weekdays. The most likely cause may be the stress, which improves with the sleep. So we want him to sleep well, and to know what is the cause for his stress factors, so that we can bring some lifestyle modifications and keep a symptom diary and give him analgesics if it is not improved with other measures. And also we can give him a referral to the headache clinics to find out further. That clear,
More, time more. Yes.
Aziza? Thank you so much.
Yes, Dr. Noor, it was good, alhamdulillah. Just one thing that talking after every 30 seconds, they ideally say, but at least after 45 seconds or something, we should keep on asking, have you understood? Have you understood? Sometimes our statements go over the time.
Okay. Means I was speaking long.
I felt so. I don't know what about others.
Flag sign we have before. We have read before
Worry.
1 day before or 2 days before that if there is a parental worry.
You mean that about imaging, doctor, MRI or what?
Yes, for the imaging, one of this red flag is parental worry. If the parents are insisting, then you will have to go for. So we can
no, in this scenario
only, we cannot refuse her.
This scenario must refuse. This scenario depends on reassurance. If you accept this, very big mistake in this scenario, because tension
Then
headache.
why
He
this
told you
in the red flags they have written this parental worry?
Red flag. No. If we give in scenario, in scenario tension headache is diagnosis, so imaging not will do imaging. This
Definitely
I
we
know.
will
I
not
don't
do,
know
I
about.
this one.
Yeah.
But what if the mother insists after even convincing
The same.
or not able to convince?
Even, yes, you will take the same. Will take the same reply. No need for that. The patient will try to reassure here. No any warning sign like this. You should reassure the mother about this. Not accept. If accept this will decrease your degree or.
Yeah, but if the mother is
No,
at the
I am
end
not
will
saying that
insist.
we will accept. We will just convince her.
Yeah, but if the mother asks, I wanted to do imaging
Then
for
we will
my child.
refer for re-evaluation to the head clinic. We can say like that.
No. For me, no, doctor. He tell you tension headache for reassure the mother. You should reassure the mother. If you tell like this, why scenario tell you the
at
tension
the end
headache?
mother still is saying that no, I want imaging for my child, then what will you say? You have convinced so many times.
Yeah, the last thing.
cannot repeat.
The last thing. I will arrange a meeting with my consultant. If
Yeah,
more,
that's why I'm
if
saying
no,
you will refer.
pressure. Yeah,
Yeah, arrange meeting with consultant or somewhere.
Yeah. But you should not change your opinion.
I
If you
was
change
saying
your
that
opinion during the
you
scenario,
didn't get me. I was saying that you will not refuse at the end. You will not say that no, I will not do this neuroimaging. You will refer somewhere. You will not say that I will not do that.
Okay, so I will give you this. What we will do is we will always escape by telling that we will give you the further referral of headache clinic. Khalas. This is the best thing.
Yes.
Yes,
Yeah.
like this. But don't, as I go with Ahmad also, the main scenario here, they have given you that this is tension headache. So we have to keep on convincing her that he does not has this, he does not has that thing, so we will not do it. And finally, we can tell her we will also refer to headache clinic where he will be again evaluated. This is the best way to escape from this.
Excuse me. Excuse me. Can I ask a question, please? First of all, if we have the scenario saying this is a tension headache already diagnosed, so we have to assume by default the danger signs are excluded, isn't it? So I can speak freely that he has it, he doesn't have so and so and so. Am I right?
Yes, you are absolutely right.
Okay, another question. It's not a routine to mention that I would like to refer you or to arrange a meeting with my consultant or my senior, unless the mother is not happy.
This way, yeah, if the mother is not happy at the end,
okay.
I was saying that you cannot refuse. You will not say, no, what was the name, mother? No, I will not suggest you for this CT scan. I will not do. No, she's not agree. Okay, you can say that. Okay, as from your part, you are not agree. So we can arrange another meeting with my consultant, or I can refer you to the head clinic. So re-evaluate this baby. What was the name? This child. To re-evaluate for this. If the child is sure that he's having the same condition or not, like this.
Okay, I get your point, but I'm talking.
1 minute,
is it
Dr.
the general
Ryan,
rule? Okay.
Yeah.
Okay,
I will refer to arrange a meeting with my consultant to convince you, not to re-evaluate you. To convince you. It's very important.
Not in every case.
Yeah. And not in every case.
Okay, this is my question. We don't usually say we're gonna arrange a meeting with my consultant is in every case, just when the mother is not happy with my explanation.
This is the last solution.
Okay. And in any scenario, when the diagnosis is done and clear, we're gonna assume the process of exclusion of the other danger signs is done. So I
Yeah.
can say he doesn't have a morning headache, he doesn't have alarming signs in terms of vomiting and so on, projectile vomiting, for example. Am I right?
Yes. Yes.
Okay,
Yes.
thank you. Thank you very much.
Hello. So we did it today, but read about tension headache. Next time there is a leaf. There is one page I wanted to read, but now I have some. I am running out of time.